Hello everyone. Today, we're delving into the world of a medication called Pantoprazole, commonly known by its brand name, Protonix. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Pantoprazole, often recognized by its brand name Protonix, is an oral tablet that falls under the category of proton pump inhibitors, PPIs. Its primary function is to reduce the production of stomach acid, making it useful in treating various gastrointestinal conditions. Protonix is commonly prescribed to alleviate symptoms and promote healing in cases of gastroesophageal reflux disease, GERD, erosive esophagitis, and Zollinger-Ellison syndrome, a rare condition characterized by excessive gastric acid production. It's also utilized in combination with antibiotics to treat Helicobacter pylori infections, which can lead to peptic ulcers. Additionally, Protonix is employed as a preventive measure for stress ulcers in critically ill patients. Warnings: Protonix comes with its set of precautions. It's important to discuss with your healthcare provider if you have any allergies, especially to proton pump inhibitors or any other medications. Before starting Protonix, inform your doctor about your medical history, particularly if you have any liver disease. Protonix may interact with certain medications, so it's crucial to disclose all the drugs, supplements, and herbal products you're currently taking to avoid potential adverse interactions. If you are pregnant, planning a pregnancy, or breastfeeding, consult with your healthcare provider before using Protonix. Before starting the medication, inform your doctor if you have ever had any severe gastrointestinal issues, such as Clostridium difficile-associated diarrhea. Additionally, if you have osteoporosis or are at risk for bone fractures, discuss this with your healthcare provider, as long-term use of PPIs like Protonix may increase the risk of bone fractures. Side effects: Like all medications, Protonix can have side effects. Common side effects may include headache, nausea, vomiting, diarrhea, stomach pain, or gas. These are typically mild and temporary. However, if you experience severe side effects such as severe diarrhea, abdominal pain, muscle spasms, or signs of kidney problems, example, changes in the amount of urine, seek medical attention promptly. In rare cases, Protonix may lead to serious side effects, including a risk of bone fractures, low magnesium levels in the blood, and an increased susceptibility to certain infections. If you notice any unusual symptoms or have concerns about potential side effects, it's essential to consult your doctor for guidance. Interactions: Protonix may interact with various medications. It's crucial to inform your doctor about all the medications, supplements, and herbal products you're currently taking to prevent any adverse interactions. Some drugs that may interact with Protonix include certain antifungal medications, anti-seizure drugs, and anti-HIV medications, among others. Dosage: Adhering to the correct dosage is essential for the effectiveness of Protonix. Always follow your doctor's recommendations when taking this medication. The typical dose for adults with GERD is 40 mg once daily for up to 8 weeks, and for erosive esophagitis, the dose may be increased to 40 mg twice daily for up to 8 weeks. For maintenance therapy, the recommended dose is 40 mg once daily. For the treatment of Zollinger-Ellison syndrome and other conditions where high stomach acid production is a concern, your doctor will determine the appropriate dosage based on your specific needs. Pediatric dosages may also vary based on the child's age and condition. Avoid: While on Protonix, it's important to take the medication as directed by your healthcare provider. You should avoid crushing, chewing, or splitting the tablets, as this can affect the way the medication is released in your body. Additionally, it's advisable to take Protonix at least 30 minutes before a meal for optimal absorption. If you miss a dose, take it as soon as you remember, but if it's close to the time for your next dose, skip the missed dose and continue with your regular dosing schedule. FAQ: Many wonder about the age restrictions for Protonix. Currently, its safety and effectiveness in children under 5 years old have not been established. Always consult with a healthcare provider for specific queries related to this medication in pediatric patients. Closing: That concludes our overview of Pantoprazole, commonly known as Protonix. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.